So I had 3 heart attacks over the course of 3 days at the age of 40.
3 heart attacks in 3 days?
Yep.
What you were doing for a day?
Listen, getting healthy can be tough. I know because I'm on my own health journey. What I've learned is that improving your heart health is important to improving your overall health. That's why we're launching this Live to the Beat series with me, your boy, Kev on Stage. We're working together to help fight cardiovascular disease in our community. It's for Black people anyway. I'm trying to help us, Black and brown folks, cook, eat, better. We talk with experts and real people alike to learn tips and tricks that can help you on the road to better heart health. Join us, join me, Kev on Stage, for laughs, great conversation, emotional stories, and life-saving info that has helped me to transform my own heart health, and hopefully yours too.
We would like to welcome each of you to the National Coalition of 100 Black Women Incorporated, the Northern Virginia chapter. The National Coalition of 100 Black Women is a nonprofit 501c3 organization. Through advocacy, we work as change agents to influence policy that promotes gender equity in health, education, and economic empowerment. We believe through our efforts, we will fulfill our vision of seeing Black women and girls living in a world where socioeconomic inequality does not exist. We endeavor to support the community as well as inspire young African-American girls and women by providing assistance and encouragement to further their education. Tonight, we will present a roundtable discussion entitled Healthy Heart-to-Heart Talk, where we will focus on nutrition, healthy lifestyles, and providing resources to the community. My name is Winifred Allen. I'm a member of the National Coalition of 100 Black Women, the Northern Virginia chapter. I'm the co-chair of the Health Committee and a licensed marriage, family, and child therapist, and the facilitator of this roundtable. We also have Dr. Kerry Register Haley, who is also another member of the Northern Virginia chapter, as well as a team member of the Fairfax County Health Department Black Mental Health Working Group. Our special guests are Miss Lady Wadike and Miss Ariana Brown. Miss Lady Wadike is a community health specialist in the Fairfax County Health Department. She serves on the Community Outreach and Development team. Ms. Ariana Brown is an exercise physiologist at Inova Fairfax Hospital who specializes in cardiac health. Thank you so much, ladies, for joining us tonight to discuss heart health and nutrition. I would like to share the background and facts from the chapter's social media campaign, highlighting nutrition and healthy heart lifestyles. Live to the Beat is a national cardiovascular disease prevention campaign created for the Black community by the Black community. Per the campaign, in February of 2022, the CDC Foundation launched a new campaign, Live to the Beat, to help address cardiovascular disease in Black adults in the United States who die from heart disease at a rate 2 times higher than their white counterparts and whose risk of death from stroke is even greater. Live to the Beat launches during American Heart Month and Black History Month, a month that also marks 2 years of the pandemic that has shined a light on health inequities that place Black adults at higher risk of COVID-19 and other major health issues, including heart disease. Cardiovascular disease, CVD, remains the leading cause of death for people of most racial and ethnic groups. Even during the COVID-19 pandemic, deaths from heart disease and stroke have increased during the pandemic, according to a report in the Journal of the American Medical Association. Furthermore, CVD is the #1 contributor to all racial disparities in life expectancy, which makes cardiovascular health a priority for CDC and the CDC Foundation to address disparities in health outcomes. Created to support the Millions Heart Initiative, Live to the Beat aims to reduce CVD risk among Black adults ages 35 through 54 with a focus on moving more, eating better, quitting smoking, and addressing key risk factors such as hypertension, high cholesterol, and high blood sugar. To inform the campaign, the CDC Foundation commissioned a national survey of 3,000 US adults that found most adults, including most Black adults, are now both aware of the threat of CVD and knowledgeable about how to prevent it. However, the same survey found that compared to other racial or ethnic groups, Black adults were least likely to view heart disease and strokes as preventable. 61% compared to 76% of white adults and 71% of Hispanic adults, revealing an opportunity to focus on increasing confidence in their ability to prevent CVD. The Live to the Beat campaign is led by the CDC Foundation and the Million Hearts Initiative. The campaign is preparing to launch Live to the Beat 2.0 later this year. So as part of the NCBW 100 missions, we advocate and partner with the community organizations and leaders to educate and bring about change in our communities. With that, I am so happy to now meet our special guest tonight to have these important and tough discussions. So again, good evening, ladies. Please take a minute to tell us about yourselves.
Good evening, all. Again, thank you so much, Winifred, for allowing me to be a part of this panel. This is a part of the world that I'm so passionate about, is inspiring and empowering others. My name is Dr. Kerry Register Haley. I have a PhD in psychology. I am also a certified professional coach, doing empowerment and leadership development coaching from my business revelation of investment coaching. And I also work in the federal government. I am so happy that we are spending time on this. This is something that's necessary and needed in our community. And so I am ready to have this conversation. Thank you.
Good evening, everybody. Thank you for the opportunity to be here. My name is Lady Wadike, and I am on the Community Outreach and Development Team for Fairfax County Health Department. Our role is to support the health of the Fairfax community, and my focus is on the African American community. I also work with Erica Logan, who is my colleague, who also supports the Stronger Squared initiative, which enhances culturally appropriate health literacy practices amongst healthcare providers and community members. So once again, thank you for having me here today. We are passionate about supporting our community.
Hello, everyone. My name is Ariana Brown. I'm an exercise physiologist at Inova. I work in a cardiac rehab department where I work with patients who have cardiovascular disease or may have some congenital effects. So I work with them in the outpatient setting after their procedures. I really focus on lifestyle modification, so encouraging them to exercise regularly, medication adherence, and educating them on their current health status and figuring out ways to improve their health to live longer lives. So thank you all for having me here as well.
Thank you so much, ladies. As a reminder, you can put your questions in the chat or come off mute to engage. So our first question is, what is metabolic syndrome and how is it linked to heart disease?
Yeah, so metabolic syndrome is it's actually a combination of different conditions. So it's diagnosed after you have 3 or more of the following conditions. So if you have a large waistline, or which is above 35 inches for women and above 50 for men. High blood pressure, if it's over 120/80. High blood sugar, if it's above 120 for your fasting glucose, high blood triglycerides, anything over 150, and then your HDL, which is your good cholesterol. So if you have 3 out of the 5 of those, you have metabolic syndrome in a sense.
Yes, so if I could chime in here, when we talk about the metabolic syndrome, and the different conditions that lead up to it, and having 3 or more of the conditions, one of the things from the mental health standpoint that we look at is, do you have a good self-care plan in place? Because having a good self-care plan in place, which entails, it could be your diet, along with intake of water, whether or not you exercise, how you meditate, or how you take care of your body on a regular reoccurring basis, can help you to manage those different conditions, but also help you to heal when you do have those different conditions. And so that's part of any kind of self-care, is a part of any kind of physiological healing. So I just wanted to add that as well.
Yes, and one of the things that I tell my clients and patients is that you have to take care of your mental health as well as your medical. One is not going to be taken care of while the other one improves. You have to do both at the same time. So that is some great information. Number 2, how does nutrition impact a healthy heart and prevent stroke and diabetes?
Yes, so heart disease prevention with nutrition, we encourage a lot of our patients to reduce the amount of processed foods, foods in high sugar, foods with elevated saturated fats, things like that. So we really encourage patients to shop in the fresh produce section and eat more like whole grains and lean meats. So steak or pork is not ideal for a heart healthy diet. But I refer all my patients to a registered dietitian regardless, because in a sense that's out of my scope of practice. I can only give general knowledge for that. But it has a huge impact on that, on your heart health in general. So it's really encouraged to seek a professional if you're interested in adjusting your diet.
Yes, and so one of the things that we also consider is our intake of water. Are we having enough water on a regular basis? And a couple of things that I practice along with what I've been taught is that how much ever weight you have, say you weigh 180 pounds, drink 90 ounces of water a day. That's a good way to flush the system, but also to decrease the amount that you eat. The other thing we know is that a lot of people eat either through stress or they eat for comfort. And so along with the things that you said, Ms. Brown, about the intake of processed foods and things like that, and if you're eating late at nighttime, at 8, 9, 10 o'clock at night, and then you're going to sleep on top of it, then you're probably not getting any healthy sleep, but your body is fighting to try to process that, which adds to the conditions that you have. So I do agree that 100% you need to see a registered dietitian. You also need to consider about how you're taking care of yourself with water. Good sleep hygiene is another thing that we need to consider. Having those 7-8 hours of sleep at nighttime so that your body is refreshed and that it's not fighting against the food that you are actually putting in the body. So those are some of the other things that we consider.
Yes, and I agree wholeheartedly with you, Dr. Haley. What we also recommend too for our clients and patients is doing a food journal, writing down what you're eating, the emotions associated with your food and your diet, because sometimes that can tell you whether or not you are depressed, if you have anxiety, if your body's changing. And so these are things that you're able to tell your doctor. These are things that do impact your heart. diabetes, stroke. So if you're depressed, you may eat more, you may eat more sugar, you may eat more salt, you may eat more carbs. So doing a food journal and charting your emotions is very important.
Yeah, and one other thing to just add here, Winifred, it just struck me when you talked about the sugar, because sugar impacts the brain and how we show up on a regular basis, right? So if we have way too much sugar in our system, we might be on a sugar high and run around, and then we crash and burn, right? Or we get like a fog, we get into a brain fog when we have too much sugar or too much processed food in our system. So those are other things to consider. So thank you for bringing that up.
Thank you. Number 3, what are risk factors for heart disease and stroke in people with diabetes?
Yeah, so there's 2 types of risk factors. We have modifiable and then we have non-modifiable risk factors. So modifiable are the ones that you can change about yourself, and non-modifiable are the ones that we can't change. So non-modifiable are things like your family history, your age, your gender, or your race. Modifiable would be things like if you exercise regularly, how is your diet? Is your weight at an ideal weight? Are you consuming too much alcohol? How is your stress levels? Cholesterol levels, blood pressure, blood sugar, and if you're a smoker. So those are all things that we can change about our lifestyle. And in those with diabetes, it's an emphasis on your blood sugar levels as well. So you really want to get those in control first.
And I think also the things that might not be so obvious to people is that with metabolic syndrome, whether it be diabetes, high blood pressure, there's a huge financial impact, and emotional and social well-being is impacted, especially if you've already dealt with diabetes or disease, any kind of disease in the family. If you have a history of that, it can also be impactful. We know that in the Black community, and not just the Black community, but the majority of Black community love Southern food, love comfort food, and that plays into it. And it also plays into it, but where we're spending our money, right? And we're financially, we're spending it in places that are not so healthy for us, whether it's with alcohol or processed foods, eating on the go, fried chicken, things that all seem to be fun and good, but it's also taking an impact on the body as well as the mind. So just being aware of that and knowing what your family history is. Sometimes individuals, I've talked to several individuals who don't know their family history, but that's a good place to start. And sometimes it's because they just don't talk about it in the family. It's a good place to dig in and dig deep.
Yes, I agree. And so we call that taking like a holistic approach. You're looking at everything, not just 1 or 2 things, but you're looking at the whole person, the whole being. You want to know what that family history is, the finances, because when you have poor finances, you have higher stress levels. So just understanding the correlations of what's going on in your life, what is going on in your family, and how that is affecting you currently, which also affects heart disease and stroke. So thank you. So number 5, what are the treatment options for diabetes, stroke, and heart disease?
Yeah, so the diabetes treatment options would be, getting the glucose control medication. So insulin, for instance, if you're having issues with high blood glucose or high blood sugar, they'll put you on some type of insulin. And then I really encourage my patients with diabetes to exercise, because that helps regulate your blood sugars. Your body will start to normalize your blood sugars over time. And then for heart disease, your doctor may put you on some type of blood pressure medication if your blood pressures are out of control, diet for sure, and then just controlling your stress in general, like we mentioned before, because that can lead to heart disease in general. So you really want to make sure that you're controlling that, and that can be controlled through exercise as well. So those are the main treatment options for those two.
Yes, I definitely agree that exercise is one of the key things. And I already talked about water intake and getting good sleep, but I also want to talk about the stress part of it can also be managed through meditation, journaling, listening to music, picking up an arts and crafts, something that's going to relax your mind so that you don't stress, and so that stress can lead to overeating as well. So these all, as Winifred said, these all play in together. This is a holistic approach. So you can't have one and be healthy in the other area. One of them is going to be compromised, or one of them is going to be a lot more out of tolerance than the other one if you don't look at both of them or holistically look at everything at one time. And then the other thing is just having good people around you. Right? Having that positive energy, those affirmations that you're doing on a regular basis, things to take time out for self, that me time is so critical to helping you heal as well.
Yes, so true. So having accountability partners, support groups, family members there helping you to get better. People that understand what you're going through and they're willing to assist you through your journey. And also, finally, not being afraid to ask for help. It's okay to ask for help. And I think a lot of us feel like we can't ask for help. We have to always be strong. But in order to get healthy, we have to be able to get the support from others and to ask for help. So I want to say this has been just an informative roundtable, a lot of good information. I hope that everyone that is hearing this got some things that they can take and use, take back to their families, take back to their friends. I want to thank Ms. Brown and Dr. Haley for participating in our roundtable and giving us just some good information that we can use. Thank you so much, ladies. So now we're going to ask Ms. Wadike if she could tell us a little bit more about resources here in Fairfax County and share with us any ongoing initiatives for the community.
Sure thing. So thank you again, Dr. Register Haley, Ms. Brown. It was a very informative discussion that I think really kicks off the opportunity for me to tell you about how you can continue your journey to heart health, or if you're just starting your journey, these are a good place to start too. So the Fairfax County Health Department actually has some nutrition services that are provided at our 5 district offices around the county. These services are offered through our Women, Infants, and Children program to people who are breastfeeding, infants, and children under 5 years old. So these services include supplemental nutritious food, counseling and education, and also breastfeeding support. And we have a few district offices around the county that offer these services, including Joseph Willard Health Center, Annandale District Office, Springfield District Office, Mount Vernon District Office, and Herndon Reston District Office. So I encourage you to reach out to the office nearest to you to find out more information about their services. Another resource that we have available is our chronic disease self-management program. And this program helps individuals with chronic conditions learn how to manage and improve their own health. So the focus of the program are on chronic conditions such as pain management, nutrition, and exercise. And it really focuses on building the skills of the participants that they need to manage their chronic conditions by sharing experiences, providing mutual support, creating weekly action plans, interactive learning, behavior modeling. So we do use a lot of tools to encourage individuals and empower individuals to learn and then turn around and teach others how to manage their chronic conditions. So if this program interests you, or you feel as though your organization may benefit from this kind of programming, please be sure to send an email to cdsmp@fairfax.gov. And then last but not least, we have information on the Fairfax Food Council, and they work to ensure that everyone has access to nutritious and sustainable and affordable food. We know that food prices are high, so we recommend that you go to the Food Council website for information about how to get food access. And you can find information at fairfaxcounty.gov/food-council. And then earlier, there was a web page that showed our heart health tips on our Fairfax County website. So please be sure to give that a visit so that you can familiarize yourself with some tips to embrace Heart Health Month. And again, kick off your journey to heart health. So thank you for giving me the opportunity to share these resources, but this is only a snapshot of what we offer at the county. So I encourage you to reach out to us if you have any questions. We love to support the community.
Thank you so much, Ms. Wadike. Wonderful Fairfax County resources. Yes, Fairfax County has a lot of resources for the community. And once again, thank you so much for also partnering with us. We appreciate you. So on behalf of the National Coalition of 100 Black Women, the Northern Virginia chapter, and our president, Gina Woods, we would like to thank our panel members, our guests, and each of you for participating and attending our roundtable. We would also like to invite you to our health fair on Saturday, April the 29th, 2023, from 10 a.m. to 2 p.m. at the James Lee Community Center in Annandale. Once again, we'd like to thank you for attending, and we hope that you have a good evening.